Last year, we've launched a new tradition in our annual meeting, which is the Sir Ibsen Lecture. Professor Ibsen, also known as the father of intensive care medicine, was a gifted anesthesiologist, revolutionary man, and a leader that his significant actions in Copenhagen during the poliomyelitis epidemic in 52-53 have led to the foundation of a multidisciplinary intensive care unit. For a revolution, you do need an inspiring, daring, revolutionary person that lives the motto, "Who dares wins." With this in mind, it's my honor and privilege to introduce the speaker for the plenary, Professor Kai Zacharowski, the immediate past president of the ESAIC, who took the ESA step forward and renamed it the ESAIC to reflect the society member paramount contribution to mankind, both anesthesiologist and intensivist. As we all know, there are two ways to present a person, a short version and a long one. If I had to use a short version to talk about Kai, I would call him a Mensch. Yiddish or German it is. It's a man of integrity and honor, a person with qualities one would hope for in a friend or a trusted colleague. This is Kai. And as for the long intro, to list many positions and tasks Kai took upon himself will take an hour. So I'll try to highlight only a few of them in sake of time. Kai is a director of the Department of Anesthesiology, Intensive Care and Pain Medicine at Frankfurt Hospital, University Hospital. It has been for years that Kai's professional life is intertwined with the ESAIC. In earlier years, he served as a council member, a NASC member. In his role as the president of the multiple joint committee of the intensive care medicine of the EMS, he was in close contact with the board. And as we all know, in recent years, he was the president. And today, for very good reasons, he was honored with the honorary member of the society. Among Kai's numerous clinical projects, most of which focus on advancing patient safety, the one he's most known for, his baby, is patient blood management. Kai, together with Professor Maybaum, founded the World PBM network, which has been gaining a respect and recognition healthcare worldwide in recent years. For his persistent leadership in the field, he received several distinguished awards. The Christopher Lohfert Award in 2014 as part of the Health Management Congress. In 2016, he was honored with the German Patient Safety Award, and finally, the prestigious award was granted to him during the Patient Safety Movement meeting in California in 2015. By the way, other recipients of that award that same year was President Barack Obama and Vice President Joe Biden. Actually, this picture with Clinton, who gave the plenary at that meeting, was taken from there. And if that is not enough, General Mark Welsh, US Air Force in Europe commander, presented a US Air Force Medal of Distinction to Professor Kai Zacharowski for his selfless and life-saving, who saved life of critically injured soldiers shooting in Frankfurt International Airport. I salute you, Kai. Kai has some other interest in life, which I can very much appreciate. Obviously, soccer. Yep. His team, Eintracht Frankfurt, is not doing that well, but still, soccer is soccer. Kai is a big fan of motorcycles and car races. And if you wish to see him smiling, big league, you have to look at him while he's having his family around him or while he was riding his motorcycles. In the last 2 years, COVID pandemic will be remembered in the medical history as the years where anesthesiologists and intensivists assumed a leadership role. COVID-19 is the eyes of the president of the ESAIC back then, is the next lecture, from ESA to ESAIC. Thank you, Kai.
Thank you, Edith. Ladies and gentlemen, Being here today with my family is just a wonderful feeling I cannot describe. Still, I have a task. The task is to give you 10 points to take home. And I was cheating with the title, From Pandemics to Frankfurt, ESAIC, FESAIC, no, it's a joke, obviously to FESAIC. And what you see is at the background, the skyline of Frankfurt. It's beautiful from our helicopter pass. And I have one conflict of interest today. I fell in love with ESAIC. 2012, I went to the American Society of Anesthesiology, and if you open the Congress book, in the first page, there was this beautiful little letter from President Barack Obama. And I have to read it because you will find out in a minute why. I send greetings to all those attending Anesthesiology 2012, the American Society of Anesthesiologists annual meeting. Organizations like ASA play an essential role in maintaining the safety and quality of our nation's healthcare system by serving as a voice for both patients and anesthesiologists, and by working to sustain and improve standards. These groups help ensure the integrity of the profession and move us towards a healthier future for all Americans. As you gather to discuss new advances in the field, I wish you all the best for an enjoyable event. Some years ago, I remember that there was this letter, so I contacted ASA headquarters, and they have forgotten about it. So we have to go back, and we should keep these moments, we should keep this information and spread the word. June 4th, 2022. I send greetings to all those attending Euroanaesthesia 2022, the European Society of Anesthesiology and Intensive Care annual meeting. Organizations like the European Society of Anesthesiology and Intensive Care play an essential role maintaining the safety and quality of our European healthcare system. By serving as a voice for both patients, anesthesiologists, and intensivists, and by working to sustain and improve standards, these groups help ensure the integrity of the profession and move us towards a healthier future for all Europeans. I would like to thank you for your outstanding service in pandemic, saving thousands of lives. I salute you, President Joe Biden. I'm very sorry I made this up. But you doing fantastic things. You're saving lives every day. And anesthesiology and intensive care is a project. And the project needs to be planned, needs to be executed, and there need to be results. And one example, it just has been mentioned, is patient blood management, patient safety, ESAIC. And you see that President Obama and President Joe Biden, they have been awarded with the humanitarian award because of Obamacare. And we have been awarded because of patient blood management. So be aware of this. But my title today was Pandemics, and I just have here a table with the 5 pandemics who killed at least 1 million people. Black Death, Spanish flu, plague of Justinian is years ago, a long time ago. But number 4, HIV, and number 5, COVID. And these are over the past 30, 40 years. So we were part of it. So 2 major diseases who killed many, many patients. And really sorry to read the other day that in the US, 1 million people died because of COVID-19. So, from pandemics to ESAIC. And basically, ESAIC was more or less founded 70 years ago. There was this polymyelitis. I will talk about this in a minute. And obviously, SARS-CoV-2 coming first from China in 2019. So, ladies and gentlemen, please stand up and remember the many healthcare professionals serving their patients and who gave their lives during the pandemic. Thank you. So, the founding of ESAIC. 1952, in Copenhagen, Denmark, there was a huge poliomyelitis epidemic. Almost 6,000 registered cases. 2,500 were experiencing respiratory and/or valvular failure. And can you imagine? There was only one iron lung available at the time and 6 gracious respirators for 2,500 patients. And here is a case of Vivi. And if you go to the archive to Copenhagen, you find the original medical note. There's a picture. 26th of August, 52. So Vivi, at the time 12 years old, presented herself to the hospital with fever and paralysis. There was this gifted young anesthesiologist, Dr. Ibsen, and he basically did his training in the US. And lots of patients died at the time. So he came up with the idea, why we're not doing a tracheotomy and ventilate the patients with a bag. At the time, the hospital was led by a microbiologist, a hygiene guy, and they were all not really familiar with his thoughts. Anyhow, they said, okay, let's do it, you can try. So, lots of people in the room, 30, 40 people in the room, and they tried to do a tracheotomy in local anesthesia. But Vivi suddenly produced a lot of mucus, she had spasm, she went pale, she went black, everybody left the room. And everybody was convinced that is the end. Dr. Ibsen stayed, and he injected 100 milligrams of thiopental. They performed the tracheotomy, and they ventilated, and Vivi survived. What is a wonderful story. The next step was 300 polio cases per week in Copenhagen. The mortality rate was over 90%. But now they had a plan. Tracheotomy, hand ventilation. And they recruited 1,500 medical students. And you see here the little girl on the right side in the top picture, and a medical student. They were all awake. They couldn't breathe. The students were begging them, reading stories to them. You see the books. 1,500 students did 165,000 ventilation hours. Almost 1 year. This is amazing. Absolutely amazing. And mortality rate went from 90 to 25%. But in life, very often, you have to have a coincidence. And at the time, the Danish brewery industry, they asked very important people, you all know the names, Astrup, Sigurd Andersen, and Severinghaus, to help them to brew better beer, better alcohol. So they developed a pH electrode, carbon dioxide electrode, and oxygen electrode. So Danish brewing industry, mainly Carlsberg, came to help medicine. Because suddenly it was possible to control ventilation by hand, by measuring CO2 and oxygen. So, the birth of intensive care medicine was in Europe, and this was a birth hour also of our beautiful society. So the history of intensive care medicine should not be forgotten. And at the time, 70 years ago, Professor Ibsen had already an idea. And the idea was for caring for all these patients in a dedicated ward with a one-to-one care of one nurse, one patient. 1953, the specialty was born, and there's a famous sentence of Dr. Ibsen at the time. He said, "I only take patients on my ward if the treating doctor, the surgeon, signs a letter." And he had to sign, "I wanted to make sure that if the patient recovered, it would be recognized as due to our treatment on the intensive care unit, and that if he did not recover, our treatment would not be blamed." In other words, the surgeons had to hand over and saying, "We have no chance anymore." And if the patient survived, then it was due to intensive care medicine. So my strong statement is anesthesia and intensive care medicine cannot be separated from each other, neither the Professor Ibsen lecture nor Sir Robert McIntosh lecture. Having a plan, executing the plan is one thing, but to bring it on paper, to spread the word is something else. And we as a society and with the Task Force Intensive Care Medicine have summarized everything, and we just have been accepted for the European Journal of Anesthesiology with perspectives from our society regarding intensive care in Europe. And you can see on the right side the authors which have done a fantastic job bringing this paper together. And the last author is our president, Professor Eduardo Robertis. And again, I just want to highlight approximately 70% of ICU beds in Europe and 100% in Scandinavia are being run by anesthesiologists. The remaining 30% managed by physicians from other surgical and medical specialties. And I believe this is important. I believe a multidisciplinary approach is the right thing to do the best for our patients. So, did you know about the pandemic of anemia? So I have to explain to you a little bit. 2015, the Melinda and Bill Gates Foundation, they did a survey and they wanted to find out what are the 30 leading health problems of humankind. And you see, number 1, lower back and neck pain. And I'm sure in this room, everybody had at some stage in life pain in the neck or the back. So we believe this. Number 4, you see iron deficiency anemia. And I tell you, if you take all forms of anemia, inflammatory causes, bone marrow causes, kidney causes, and so on, suddenly anemia is the most leading problem of humankind. And we together have to claim anemia as our third disease. Which diseases do we have? We claim sepsis. We claim a disease where patients get hot, caused by volatile anesthetics. And the third one is we have to claim anemia. And why is that? Because anemia, prior surgery, is outcome relevant. Patients being operated, elective operation, elective surgery, stay 20% longer in the hospital. They have a twofold increased risk to attract infection, a fourfold increased risk of renal damage, a threefold increased risk of dying, and a fivefold increased risk of transfusion. It's in your hands. And therefore, anemia should be claimed and should be fixed before we send patients to theater. There's also the pandemic of blood loss. And I'll show you this nice work from America. Patients undergoing cardiac surgery. Surgery was fine. And then when they were on the ward, they lost every 10 days 1 liter of blood only due to phlebotomy. Can you imagine 1 liter? A lady, 3 liters of blood volume. A guy, 6 liters. You know where it ends. We as a society, but also on a local level, on a national level, you have to get in contact with health insurance companies. We manage this in Germany with the second biggest health insurance provider, with Barmer, and we convince them to go through their own database and to find out about patient blood management. And they realized patient blood management is something what needs to be introduced on a national level, and the health insurance companies are saving money and the patients have a better outcome. So a report has been written in 2019 which now leads to a change in Germany that anemia diagnostics and treatment will be paid in the future on the initiative of our society. 2014, and you have seen it in the picture and one of the slides of Kate, we have been contacted by our Ministry of Foreign Affairs. A 30-year-old doctor from Sierra Leone who built his own Ebola treatment station, at the right picture at the bottom, got infected. And we as a hospital in Frankfurt said, yes, we take this patient. And it was an unbelievable journey for this man. 4-hour drive on a gravel road, 6 hours flight in a box, severely ill. And you see on the top left the press conference. At the time, I was leading this mission in the hospital, and we have been facing a lot of criticism from the public. How can you bring Ebola to Frankfurt? And at the left bottom you see the room where the patient was, and we had to intubate the patient, we had to do renal replacement therapy and many other things. And what I'm trying to say is, it's a single case, but we have to make sure that we bring it on paper. And the reason why I've marked this is there's a story behind. The patient received a 3-day treatment course with FXO6. FXO6 is a fibrin fragment we all have in our bodies. A fibrin-derived peptide under clinical development for vascular leak syndrome. After FXO6 administration and concurrent detection of Ebola virus-specific antibodies and a fall in viral load, vascular leak syndrome and respiratory parameters substantially improved. And this is a picture you need to see. And the important thing is, we're talking about the lung. All the organs of this patient had edema, severe edema, and organ failure. And when we were giving the drug FXO6, you can see here, significantly edema in the body went down. The patient survived. And I was doing a search, how much money did it cost to save our colleague, a doctor? And you can see at the bottom on the right side, 1 million euro. And my claim was always ethics over cost. And these are the 2 European Union projects. On the right side, I just want to highlight, in Covent, we are now using exactly this drug we used in Ebola to fight against vascular leakage. And we have been founded with 10 million euro. And the wonderful thing is, lots of groups who are participating in this trial are sitting here. And I'm very proud of our European network. The fellowships have been mentioned, and I urge you, if you fulfill the criteria, please apply. We're not throwing them out at you. You You have to deserve it. But if you deserve it, you will receive it. And tomorrow we have our award ceremony for the fellowships. And these two gentlemen, Paolo Pelosi and Steph de Hert, were the first ones of the society who received these fellowships. And you see what everything is possible because we did it in face-to-face and virtual. Steph looks almost like that he was with us, but he couldn't come at the time.
Anesthesia is scary. There's always this moment just before you get anesthetized when you feel the most vulnerable. But don't worry, I'll be your guardian angel, supporting your organs and protecting your life. I'm an anesthesiologist, and you don't know this, but I'm a medical doctor with huge understanding of all body function, and I'm everywhere in the hospital. I may not wield a scalpel, but diagnose you constantly and manage your pain. I make sure that your complex organs are working. Your lungs, your heart, even your brain. I'm one of the most resilient and versatile physicians you'll meet. I'm an expert on resuscitation. And when you're in an accident, I'm first on the scene. But I'm also integral in intensive care, where I'll treat the most complex situations, including the worst COVID cases. Ever since the invention of ether as an anesthetic, surgery stopped being equal to pain. That was 175 years ago. And today, my role has only grown, because your safety and well-being is my priority.
The reason why I'm showing you this is we have to be proud of what we're doing. And we have to talk about it. And I'm always saying, if you talk to people on the street, if you have the chance to politicians, ask them, what is an anesthesiologist? What is their job? What are we doing in intensive care medicine? And we have to educate people. Only if we educate, we get the recognition we deserve. And I urge you also, as a group, as colleagues, as doctors, as friends, we have to collect data. And we have a discipline. We are producing enormous amount of data, but they need to be collected, they need to be analyzed, and then to draw conclusions, and then finally publications. And that is the only way we'll be being recognized by governments, by parliaments, etc. And we just managed with the German PBM network, we finished our collection of data, 1.4 million patients, and the publication has just been now brought to the journal, and now we're starting our European PBM network, and I invite you all to be part of it, because it's important to talk about it. And finally, I have to say thank you to my family, because I wasn't at home very often. And especially my wife, my children, they allowed me what I'm doing. And they allowed me being here, they allowed me trying to bring things forward. And I really have to say, not only thank you, but also I love you and I salute you. Thank you very much.